Good morning. After wonderful talk about the heart, I think everyone must be thinking what they're going to do from tomorrow. Going to do exercise, diet and weight. Thank you very much for invitation, Krishna Rao Garu and the team. I'm privileged to be here and expressing my thoughts about digital and AI future in India. And my brother, I think, already mentioned about our medical college, SVS Medical College. He is the founder chairman and he is the one who started the medical college. I was in UK that time and he called me back to be part of it. But he is the main person who thoughts were executed. And he's like our father because there's so much of age. There's 10 years age difference between me and him. And as you know, we started in 98, our hospital, and 99 was the first batch. Telemedicine, I think nice words said about. It's like Swiggy and Zomato. I think I use a lot of telemedicine. My online appointments are booked next 3 months. And it's become so convenient. Nowadays, what happens is about 30 to 40% of my patients come from out of the state, out of the country. Previously, the biggest problem was to follow them up, see their x-rays, see their progress. Now with video consultation, we were able to see them, talk to them, examine them over the video, and they upload all their x-rays, their reports, and it's all confidential. I use Apollo 24/7 app and other apps, millions using Apollo 24/7, and all integrated. The medical record is kept all the way through, and it's very confidential. Nobody can access except the doctor concerned and the patient, because patient data is very critical, and data theft is a big problem across the world. Coming to my talk today, I thought the technology is the future. And that's my declaration. No payment was done for this talk. And of course, technology. Other day, someone was asking me, sir, AI is going to replace us. In future, all the jobs are done by robots or technology. That's not true. It's not going to replace human beings, but it will replace people who are not trained in the technology. Those who will integrate technology into their career, they will flourish. So it's important, especially for the youngsters, to get trained in technology. Otherwise, you will perish. And I think a lot of improvements have come. There's so much going on in AI every day. Is monitored, all of us monitored by AI, where we are with our iPhone or with a watch. Google is monitoring us, and how many people are there, what you are talking, what images being displayed. So it is very important that we know what we are doing. And this is the feature value of digital technology, AI, and so much. So some of the youngsters can be innovators, can invest in AI, become the leaders in health and AI. So you can lead the future, especially in orthopedics. AI plays a big role. The incidence of medical legal cases come down significantly. People attending emergency medicine, casualty, especially across the world, especially America and Europe. Previously, any missed fracture by a doctor was sued. With technology, AI technology, I think the recognition or diagnosis of fracture rate has gone significantly. Middle of the night, somebody comes up the fall, get an X-ray, you may not be able to identify the fracture. If you miss, they continue with the pain, they come back, and repeat X-ray or senior person seeing the X-ray will identify, and the person who suffers may be sued. So that is replaced by AI. So there's a big role of AI in musculoskeletal radiology. And so many softwares have come because the machine, computer will have thousands of X-rays. If you put an X-ray, it will tell you what is the condition or is there any fracture, especially osteoporosis. Previously, there was no single test to detect osteoporosis. But now, with AI, we can detect especially early. I just want to know how many orthopedic doctors are there here? How many are? So that I can modulate my students. Orthopedic PGs, yeah, okay. Thank you. And of course, we have to learn. Otherwise, difficult to see the results. And of course, this is what I've been saying. So there's thousands of X-rays put into the machine and it will match. And it doesn't take much time. So accuracy goes up significantly. Some of these examples you can see, there was not very obvious, but you can later on, you can see there is a fracture. This is a common fracture attending emergency room, middle of the night. And of course, you can see whether your operation is right or not with AI. Because people have loaded good X-rays, good results. So you can put in X-ray and you can ask whether what percentage of my operation is to the average or to the standards, minimum standards. And of course, previously what happens is data analysis, publication was very difficult because we had to keep everything in the shelves or in the computer. Now with AI technology, with a simple app, you can upload all the X-rays and you can ask for analysis and you can design how to analyze, design study, execute, and you can ask for results and easy to publish papers. And of course, in a spine fracture, detection is very difficult with standard X-rays. With AI technology, you can have very high rate of detection. And similarly, in orthopedics, knee injuries, ACL, PCL, and cartilage damage, you can identify, you can quantify what is the amount of damage. And especially in osteoarthritis, now we are able to do cartilage mapping. Get an MRI scan, we can do cartilage mapping and find out how much damage is done inside your knee and what would be the appropriate treatment. And so many apps have come, you can see. And of course, in orthopedics, robotic orthopedic surgery is ever changing since the times it's started in the knee replacement, hip replacement, spine surgery, trauma, and in sports. Because AI or robotic surgery very convenient for orthopedics. We have a fixed bony landmarks. So very easy to assess the robo to define the landmarks and assess whether you've done the right operation or not. We are restoring normal anatomy. Orthopedics is nothing but restoring normal anatomy, restoring normal movements. So you can assess very easily. And why technology? Of course, as I said, if you don't integrate into technology, very difficult to survive in future. So in 1950s, for any knee replacement or hip replacement, we used to have static plan, get an X-ray, plan, and probably we don't know that planning works on the table because the X-ray may not clearly say what was there inside the patient. And in 90s was computer navigation. We are among the first to buy the computer navigation in 2006 from Germany, Brain Lab. And of course now robotic assisted surgery, which is very popular. So we started, I'm from PGH Chandigarh, we started in the 80s. We are among the first ones to start knee replacement surgery in India. So those days, difficult, because we used to take about 3.5 hours for each knee replacement. Now things have changed. We can do it 25 to 30 minutes because of the technology, because of understanding, because of the instrumentation made very surgeon friendly. And I worked in Royal London Hospital. I'm sure some of the orthopedic surgeons know Mike Freeman, who invented knee replacements in Europe. He is among the two who invented knee replacement. I was the last registrar to work for him. And there we started some of the navigation. And what happens, I'll give you an example of knee replacements. Conventional, we use guides to cut the surface, and accuracy is not great. It's about 70 to 90%. And in femur tibia, I don't go into details, but there's so many publications saying that robotic assisted knee replacements, the patient satisfaction is much higher because the pain is less, we cut less tissues, faster recovery, and they regain muscle strength much quicker. As you know, the significant number of patient dissatisfaction following knee replacement, so many reasons are there. I don't want to go into detail, but that can be reduced using AI robotic assisted surgeries. These are all technical, and what I'll just show you what exactly happens. This is conventional. This side is conventional, and this is robotic. So the optimum range was within that circle. So we are able to get many patients within expected range. So the outliers are less, and always there's a learning curve. And we used to say in the past, you have to work with a surgeon, experienced surgeon, maybe 5 years, 10 years. Then only you become good orthoplasty surgeon or orthopedic surgeon. With AI, that has changed. You don't have to work so many hours. It is reducing the amount of learning, especially for youngsters. You don't have to work 10 years. Maybe a couple of years, if you are good with computers, and you can be expert surgeon, provided you know the normal anatomy, normal knee replacement. So the learning curve has come down significantly. Surgeon also, what happens is, because especially when you're operating on VIPs, what happens is a lot of stress. So many phone calls will come. Somebody will call the operation tomorrow schedule. So many things will come. And once you become experienced surgeon, you know what would be the difficulties. It's more difficult to rather deal with the attenders rather than the patient itself. So this reduces the stress because you planned. You took a CT scan, you know what you're going to do, and you execute in the theater. You also know what you planned you're going to execute, and whether you've done the right thing or wrong, computer or a robot will tell you. So the stress levels of surgeons will come down if you use a robotic assisted surgery. So just tell you what exactly robot does. I think I think what happens is robotic surgery. Most of the people think that robot will do surgery. It's not. We do the surgery, but instead of using hand instruments or hand saw, we use robotic arm. If we cut with a saw with my hands, there will be error of 1 millimeter. If we use a robot, it's about 0.1 millimeter. What we do with robotic surgery, we take a CT scan of the knee, we see the alignment, the deformity, we see how much is damaged, we measure the size of the knee joint, the 3 components in the knee, we size the size of the femur, tibia, and the patella, and put into the computer, and during operation, we cut exactly what we planned. See, this is the robo cutting, and this is the monitor. It will tell us how much you are cutting, and safeguard. We keep away from the vital structures, nerves and arteries, so that it doesn't damage. So that is the robo cutting, and you can see on the monitor which part is being cut. There is instant feedback, and you monitor throughout. It takes about 6 to 7 minutes to finish the procedure. That's a burr cutting the femur, and the burr finish is in diamonds and jewelries. Burr is a precision, is more than a saw. So this is one of the burr-based robo. There are saw-based robos as well. I use that one as well. And once you have the final product, and you can check instantly whether your cut is right or not. It will show on the screen how much you cut, how much is the size with and what happened. This is, I think, difficult only orthopedic surgeons to understand. Deformity, we started with the deformity and we correct the deformity and by placing the implants and post-op radiographs will be excellent. That's the, you can see, in the past we used to make a big incision. With the robotic, the incision has come down, so the pain is less, muscle recovery is faster, and they happier patients. So this is a severe deformed knee, as you can see, very deformed knee. We can, with the conventional, probably it would be difficult to correct the deformity at the bony level. What we used to do conventionally, we used to release all the tissues, make it straight, release the ligaments. But with the robo, we do not release the ligaments. We correct the deformity in the bony level, which is the culprit. So that becomes, that is an extension, this is a flexion. And you can see, final check. Same gap. We check the gap, that's a 13 millimeters, 14 millimeters, 12 millimeters, 13 millimeters. So the gaps balanced means knee is straight. So there's so many people, example, I'll take tomorrow. So people in the previously had operation, this patient had a nail. To do conventional surgery, we need 2 operations. To take the nail out and do the knee replacement. With the robotic technology, we can keep the nail in and do the surgery. Because we don't use the jigs. And of course, the total hip replacement also become very easy. Positional cup, positional stem, and the balancing, soft tissue balancing becomes very simple because on the table you can check whether the balancing is correct or not. Spine surgery, robotics are very useful. Arthroscopy, very useful. And clinical evidence, the immediate results, because the robotics have been in maybe 5-6 years. We have to wait maybe 10, 20, 30 years because we can't say today done knee replacement is successful by saying tomorrow X-ray. It has to survive 20 years, 30 years. That's the biggest problem with the knee replacement. You can't say knee replacement successful after a few days. It has to survive benchmark of 10, 20, 30 years. Then only you can say the knee replacement is successful. And of course, so many studies are there. Of course, the challenges today is high initial cost, sometimes initial stage, little longer duration, and anesthesia little longer. It needs extra skills, probably initially longer learning curve. It does not replace normal surgeons. It will only replace untrained surgeons. So, take-home message would be, AI and robotics are transforming both radiology and orthopedic surgery, higher diagnostic accuracy, more predictable surgical outcomes. So we can predict what we're going to achieve by planning and achieving on the table. Because we do the operation, get an X-ray, the operation theater here, you can rectify on the table itself. And it's a personalized procedure because every knee is different. In a conventional procedure, what happens is standard knees based on European skeletons, 1, 2, 3, 4 sizes. Here, we can design your own knee with using robo. So we can accurately measure your knee and we can personalize your knee replacement surgery. Of course, future is collaborative, precise, and intelligent. What I would request for the youngsters, be the leaders, innovators. India is global leader. And with current Modi government, there's so much is going on. And recently announced startup company, especially for the doctors, innovative healthcare and AI in healthcare. Thank you once again for Krishna Rao Garu and their team for having me here. And thank you once again. Question, okay.
And I'm looking forward to your answers.
Sure. I think that's it. telemedicine, I think what happened is now the globe has become very small. I see patients from remote places in African countries or in Assam, West Bengal, because of the telemedicine, video consultation. And there is some of the not orthopedic robots, but general surgery robots, especially prostate surgeries and other surgery, there is telemedicine. You can monitor from a city to do surgery in remote places. And one more thing, the robotics, initially they were sold very high cost. Now, because companies, now robo is free, provided you do their implants. Previously it was about 12 crores. Now, robo provided free. We have robo in SCS college. And we do very low cost. I mean, knee replacements, we do cost to cost. 1 lakh is knee replacements. If they pay 1,20,000, the robotic knee surgery. So what happens is, robo is provided free, like orthopedic instrumentation are provided free. Robo is a tool. So companies become so competitive, they are providing free, provided you do their implants and do certain numbers in a year. If you do about 200 knee joints for that company, they will provide robo free of cost, and you buy their consumables. And other question, I think remote, I think very soon it will happen because there's so many surgeons across the India, remote places, if they have a good setup, and robotic surgery doesn't need a big setup. Any ordinary theatre, or optimal theatre, and they can set it up with telemedicine, orthopedic robots, they're working on it. I mentor, I'm proctorship for a few countries, African countries, Indonesia, I proctor from here. So it is possible, provided you have the trained orthopedic surgeon, you can take him through the operation.
After a fracture or after
That's a very good question because orthopedics is nothing but rehabilitation. Surgery is 50%, rehabilitation is 50%. Unless they are rehabilitated, make them back to work, back to their normal activities, no point of doing a big surgery. There is a big robotic rehabilitation, and it's more useful in rehabilitation because lack of time, I did mention that there is a big role because there's structured monitoring and you can assess the patient. Previously, what happens is the assessment was mainly subjective. Now, the robotic technology, AI technology, you can assess objectively and you can monitor. So, there's a big role in rehabilitation, AI and robotics. What happens is because, as I said, majority of my patients come from across India, so rehabilitation is very, very important. What we do, we bring one of the physiotherapists from the area, they come here, spend some time, they go back, and we monitor on video consultation. So, what they do first, 6 weeks is very important for a knee replacement. So, they go every day to the patients. They show the exercise, they make them walk. They also see any problem with the wounds, with their general health. They big video consultation, they will be physiotherapists. They are the best rehabilitation. They are the best people to rehabilitate the patients. So not only physiotherapy, they update us, they progress for our progress. That's I think very interesting. That's very much possible. With the telemedicine, you can, I think the trained people, they have to come, train them, physically they have to see, they go back and they can do the video. Absolutely, even people in Hyderabad, some of the people do not come to follow. They do online booking, video consultation, ease of convenience. So I think future would be telemedicine and teleconsultation. Yes, thank you.
May I now invite Dr. Sabit Syed, Dean, Maheshwara Medical College and Hospital, to felicitate Dr. KJ Reddy.
Small thing I had tell you here. When he was 11 years elder to me, when he was very small boy, my mother used to go to field to see the field work. 6 months old boy. I used to keep with me when she was away from home. So on but so then we shifted to other place for high school. So he was in the village only. Whenever we come from, after 1 week, we come from this high school to home, he used to cut hold of my legs like this. And now, it's like that. Very affectionate. So after some time, he became famous orthopedic surgeon. So one day he said, your knees are damaged. So as a geologist, I worked in various places in India. So various places like Bihar, UP, Banaras, so many places I have worked in geological survey. So at the age of 60, I got this, my knees were damaged. So he said, so we have to replace. So 14 years back, he replaced my knees. So still, today, nothing is, yes, I have refreshed knees. So that is the affection and that is the expertise he has got in.